Good afternoon. I'm Lori Wendell, and this is
Doc-
Dr. I'm sorry, go ahead there.
Dr. Darren Vance, go ahead.
I'm a nurse practitioner, by the way. We're with Ascent Elite Health, and I think you guys know that, but we're just coming in today to answer a few questions again. One of the things I'm going to talk about first today is hormone replacement therapy for women. There's been such a dilemma for so many years over this therapy. And, women were on estrogen therapy years ago, was more like from a mare. They used the urine from a mare, and they had some good results with this estrogen, but they did a study. They had two different arms of the study, pre or perimenopausal women, and they had postmenopausal women, 10 years postmenopause. And they were looking at the estrogen levels. And basically, at the end of the study, there was like 10,000 in each arm of that study. And not to get into debt too much with that, but basically, when they got wind of the report, the media took the report and gave the relative risk reduction. They didn't look at the absolute risk reduction. So the numbers look like majorly high for an increase in cancer. So it looked like 25% increased risk for cancer for these women. So what happens? Women are terrified to take estrogen. They stop taking their therapy. 80% of women did that. Physicians would not order that estrogen or hormone replacement. It was like a nightmare for several years. This was in 2002. So this has been 20 some years ago. And, they've been actually taking that study and they've reviewed those studies and written more of the actual data, but no one seems to care about those. They don't want to look at those. We're way behind the times. We're 20 years behind time. It's going to take 20 years for people to start treating menopause the way they should. There are a lot of people that are out there trailing the way, trailblazers, and we're trying to be that person as well, because these people are miserable. Women are miserable. They are starting having in their 40s. They're having brain fog. They basically they have night sweats,
Perimenopausal symptoms the last 15 years.
Last 15 years.
Yeah.
So until you reach that point and have those symptoms, you do not have empathy for that patient. I came into this practice and I was on oral hormone replacement that wasn't doing anything for me. I was having symptoms. I checked myself down and I did the labs. I started treating myself. I started feeling better. And then it just takes sometimes as a woman provider or a woman physician to say, oh my God, I've ignored these people for so many years. I practice cardiology, so I didn't deal with that. But now that I'm in this practice, this is an everyday patient.
There's a lot of women suffering in silence.
Absolutely. They're suffering in silence. And they try to tell the doctor and they don't listen. So basically my message today about that therapy is, and I had a question yesterday about that. Well, I can't take that. I can have cancer. Well, even 10 years postmenopause, a woman can take estrogen therapy to help prevent osteoporosis, reduce risk for coronary disease.
Significant risk for coronary disease.
And that's the number one killer with women. And there's also dementia because we have these vascular issues. Yeah. And these things can be prevented with hormone replacement therapy. Now, that being said, my patient yesterday was 70. Now she has a high risk of coronary disease in her family. So I'm going to run a calcium screening score on her, make sure she has no issues that can cause an issue there for coronary disease, if it could make a plaque rupture or anything like that with estrogen. So what we're going to do is if her calcium screening score is fine, she's going on some estrogen therapy and whatever she needs. I'm just not going to ignore the patients anymore. I have not been doing that.
Age is irrelevant.
Age is irrelevant.
It doesn't matter how old you are. You have the right to feel good.
Exactly. And we've just suffered for so long. And so many women have. And in this practice, and that's just something, that's the feel good thing about here. People coming in every day. Oh my gosh, I feel so good. And I've been complaining for 3 years. So I just wanted to put the hush on the cancer. It's still a scary thing. If you have someone in your family that has estrogen positive breast cancer, and that's something that's there, we won't put estrogen in your hormone replacement.
Well, we can do genetic screening too for the BRCA1 gene. There's a lot of things we can do to rule that out.
And, if you have issues with, we're going to say it out there, vaginal dryness, we can put estriol in that. That's not estrogen. It's not estradiol.
Big difference,
so that can help with that problem. So just because you have that going on doesn't mean you cannot get some assistance. So always remember, bioidentical hormone replacement therapy, it's more natural. We're going to screen you completely, and we're going to make sure that we can put you in that therapy safely. So I just wanted to kind of clear the air on that today.
Yeah, and you have the right to feel good, right? And age, like I said, is irrelevant. So it doesn't matter if you're 74, if you're 34. You should not have fatigue. You should not have this where you're just so tired you can't carry out your daily life. And women really just have been given a bad rap about that. But hey, where you're this set age, you've got kids, you should be tired. That's not the case at all. So, if you're having those issues, contact someone, contact your physician, obviously contact us if you'd like to, because it's something definitely we could address. And there's no reason why you can't feel better.
I'm not going to, I have to make somewhat of an excuse for providers. And, they're not taught that.
They're not.
They're not. They need to focus more. There's not a lot of money put into studies for menopause. Money even appropriated from the government. They don't put the money they get for reproductive diseases and so forth. They put it in other areas other than menopause, and that is what needs to be studied. That's 25, 30, 40 years of someone's life, literally, that's not looked at closely. And they're trying to put through more legislation to bring more money into the menopause situation, but it's just going to take years. So we have to be very proactive, ladies, and just
especially now when we look at all the contaminants in our environment,
absolutely
microplastics, we get all the phytoestrogens, all these other things floating around, antibiotics, they're in the food supply, plus all the chemicals from herbicides and those types of things. Women are starting their perimenopausal symptoms much earlier than what they should, which isn't good either, because that really puts you kind of in as a, that slows down or basically, stops your anti-aging process and basically increases your likelihood of having a less longevity. So, these are things that need to be addressed. They need to be addressed relatively quickly so that you can get it under control and feel a lot better. Like, it is a night and day difference for these women. And it's just, you don't have to suffer. Women have gotten a really bad rap about it. Menopause and the hysteria and these things that are out there because of it. So it's one of those things, if this is the way you feel and you can feel better, see a provider.
That's right. And they don't want to listen to you. They don't want to talk to you about hormone replacement. They don't even want to run your hormones. Call us, because we will take care of that.
Absolutely. So the rest of our questions, we've had a ton of stuff about blood sugars and management of blood sugars and insulin and those types of things and what kind of effect it has on the health. Also on our website, totalhealthpros.com. We've got several blogs on there to address a lot of these issues with insulin and several of the other things, DHEA, tons of other things. So if you've got some time and really want to learn more about health, by all means, go to our website, totalhealthpros.com, and read the blog section in there. Okay?
Absolutely.
But one question came in from Eric from Milton. How can I tell if a food is high or low in sugars or carbohydrates? Okay. One thing, number one, is read nutrition labels, right? A lot of people have gotten away from that. All nutrition labels are going to tell you carbohydrates. It's going to tell you added sugars. It's going to tell you basically the carbohydrates that are in there, if it's got an added sugar alcohol. And so when you look at the nutrition label, whatever carbohydrates are in there, if you subtract the sugar alcohols, those are non-insulin producing nutrients within the sugar or within the nutrition label. So you subtract that out, and then you subtract out fiber, and that's going to give you a good idea of what your actual sugar intake is off of that carbohydrate. So let's say if it's something to make the math easy, let's say that it says 20 carbohydrates, it's got 10 grams of sugar alcohols. 20 minus 10, we're down to 10 carbohydrates. If it's got 3 grams of fiber, then we're only looking at 7 grams of carbohydrates. And then it'll have specifically the number of added sugars. So then let's say if it says added sugars are 5, then we know that of the 7 carbohydrates that are left in there, it's 5 grams of sugar. Yeah. And so that's a good bit of sugar. It's 4 grams of sugar is 1 teaspoon. So if you've got something that's got 8 grams of sugar, that's 2 teaspoons of sugar in whatever you're eating. Okay. So reading nutrition labels is one thing. Then the other thing is really looking at glycemic index. The glycemic index is very accurate. You can find that if you look up on the internet. And what it's going to do is list foods from high to low. Higher glycemic index means that it has a lot more sugar in it. Lower glycemic index, a lot less sugar in it, right? So you want to eat foods primarily off that low glycemic index. Sugars are going to be high in your fruits, right? And a lot of your fruits, other than really your berries, they're going to be low glycemic index. So it's one of those things, again, look up the low glycemic index, read the nutrition label. That's going to be your majority of ways to tell if a food is high in sugars. And then it's also going to give you information on the carbohydrates. And remember, a high carbohydrate diet, all carbohydrates break down to sugars eventually anyway. So if you're eating a high carbohydrate diet, it's something to be looking into because it could be affecting your insulin levels on a prolonged period. Plus it could be affecting your triglycerides. And over a long period of time, Lori, especially as a cardiac, with her cardiac background, tell you triglycerides building up in your system at high levels is a really bad thing.
Yes.
So you can be eating very clean, but if you have a high carbohydrate diet, some patients, even though they're eating good carbohydrates because they're eating so many of them and because of the insulin reaction, can have some triglyceride issues, can have some lipid issues because of their diet and the carbs that are there. So that's one of those things to always be attentive of and then and look into and really track, macro tracking with a food app like MyFitnessPal, Calorie Counter, any of those could be very beneficial. Makes it a lot easier keeping track of your sugars as well. Laura, I'll let you take this next one, but I'll read it. Dan from Poca asked, I heard someone in the gym discussing keto diet. They said that protein can spike your blood sugars. Whey protein can spike your blood sugars. Is that correct? We've kind of talked about this. Whey is filtered milk.
Right.
So filtered milk doesn't matter. Whey protein is going to spike your blood sugars. Even though it says on the back of the label, say 4 grams of carbohydrates, because it's still filtered milk, whey protein will spike blood sugars, right? It's not going to spike it through the roof, but if you're on a keto diet, it's going to throw you out of the ketosis for sure. Even casein protein, which is a very slow digesting whey protein base that a lot of people use at night before they go to bed because it helps feed the muscles overnight. Even a lot of times with that, casein will even cause a significant spike in insulin because again, it's just filtered milk. It's filtered dairy. So it's one of those things you've got to watch. One thing I would suggest is if you're concerned about it, wear a continuous glucose monitor.
Yeah, you can.
Lori's prescribed those for a lot of patients. They work great. And what you could do is actually track your blood sugars, track your blood sugar prior to ingesting, say, whey protein, casein protein, whatever. See what your blood sugars do, track it. And then, that way you'll know if you're susceptible to that or not. But yes, whey protein, absolutely, because it is just filtered milk. It's a dairy product. It will spike your blood sugars and your insulins.
And John from Chase Valley, he's saying, what's a good level for blood sugars? We're functional medicine, so we like to look at a blood sugar. We like to see it around 80s, in the 80s, 75 to 85. When we see people having blood sugars around 95, 105, they're getting to the top level. That being said, you can have a normal blood sugar, and you could have a normal hemoglobin A1C, which is a 3-month window of your blood sugar. Right. But by golly, you can have a fasting insulin that's elevated. You're just becoming insulin resistant because partly what your diet is, you can't process those. So the carbohydrates and sugars. So basically, the blood sugar level, even though we're telling you what's a good blood sugar level, from our standpoint, we don't just look at that. So we like to look at the whole picture, look at deeper, because you may have a normal blood sugar with 85, 75, 90. But if we look deeper, there may be another underlying problem. So you just can't rely on that fasting blood sugar for everything, especially if you've had a little bit of weight gain, abdominal weight gain. Sometimes that's a key factor to show you're having some insulin resistance.
Yeah, belly fat's a key indicator in regards to your insulin resistance. And really, when you're looking outright, really, if you're looking at straight lab value, 0 to 99 is considered normal. We wouldn't say it's optimal. Really, above 88, we like to say you're leaning more towards a high sugar kind of thing. But really, when you look at 101 to 125, that's pre-diabetic.
Yes.
And anything over 125, so 126 and above, technically is diabetic blood sugars. And that's not much of a window, right? And so those are things you've got to really pay attention to and watch. But again, that's not the only key indicator that's important. Like Lori suggested, we've got to look at hemoglobin A1C. We really need to look at fasting insulin. So there's a lot of things that go into that. But if we're looking at just straight metrics, 0 to 99, in our case, 0 to 88, we consider to be normal. But anything between 100 and 125 is pre-diabetic. Anything over 125 is considered diabetic.
All right, Darren. Peter from Morgantown. I hear so much about controlling insulin. Why is it so important?
Well, a couple of things. So if you are in a spot where you're wanting to lose weight, insulin is a highly anabolic hormone. Matter of fact, it's the most anabolic hormone our body produces. So in the presence of insulin, fat oxidation or fat burning completely shuts off, right? Because fat burning, fat oxidation is a tearing down or a catabolic event. Insulin is an anabolic event. And so insulin is always going to trump fat burning, fat oxidation. So if you're wanting to lose weight and your insulin level stays high, it's going to slow that process, that fat burning process, fat oxidation process down significantly, if not shut it off altogether. Okay. So that's one issue. The other issue with controlling insulin and keeping it low is that after a period of time, the insulin level, we see this in bodybuilders, high carbohydrate diets. We see it in endurance athletes, even though they physically look healthy. When you start seeing that exposure to insulin over a long period of time, high levels of insulin, your cells get worn out to being present. Yes. So basically, insulin is a carrier molecule. And so it carries nutrients from the blood to the cell. And so after a period of time where insulin is highly present, the cells get tired of insulin knocking on the door saying, hey, I'm here for another delivery. So they kind of just start shutting the door in the face of the insulin, say, I don't want you anymore, right? And so then insulin is stuck. It can't do anything. It can't function as it's supposed to. So then we've got these blood sugars and these nutrients floating around in our blood with nothing to do. So then what happens? They have to be shunted to the liver where they're stored basically as liver glycogen or fat on the liver or turned into a triglyceride to be stored, right? So the triglycerides, again, like we talked about earlier, triglycerides are excess carbohydrates and excess sugars. So when you look at having to worry about your insulin, that's why it's so important, because it does so many things. Now, insulin's great though. It has a role because again, it does shuttle nutrients from the blood to the cells. So we can manipulate insulin, and you'll see bodybuilders, you'll see them talking about taking insulin. We don't advocate this by any means.
Absolutely not.
But they're taking high levels of insulin with high levels of carbohydrate post-workout to really cause their cells to take in as much
as they can,
sugar and nutrients as possible. Gets extremely dangerous because the problem is insulin grabs everything it can right out of the blood. So what can happen is if you don't have enough carbohydrates or sugar in the blood, blood sugar drop, you're going to pass out, go into hypoglycemia. You can actually go into shock. There's a lot of things that can go seriously wrong and can even be deadly when you start trying to manipulate insulin and you don't really know what you're doing, because it is that strong of a hormone. It's the strongest hormone our body produces. It acts very quickly. You can't stop it once it's in its process. And so it's one of those things that controlling your insulin and controlling your diet is of key importance when controlling insulin. And I bet, what would you say, number of our patients that probably come in with insulin resistance?
Oh, it's getting higher. It's very high. I'd say I would not be afraid to say 40-50% right now.
At least, I would say.
At least that.
Yeah.
It's amazing. And you just don't think it. You'll see someone who's actually even thinner that has an insulin resistance.
Yes.
And you wouldn't expect it. It's just it's absolutely crazy. It's just I think the food we eat, like you said, everything that's going on in this world we talked about earlier, you're getting exposed to so many things. But I'll tell you, the processed food that we eat is one of the number one problems with a lot of this, because it's full of everything.
Yes.
They're not eating clean. And actually, that's one of the next questions.
That was actually Paulette from St. Albans asked, if I eat clean, do I need to worry about my blood sugar? I'll let you run with that one, Lori.
Well, eating clean, if you
what does that mean?
What does that mean?
Yes.
You got to know what that means. That's a good point, Darren. I eat clean. Darren eats clean. He's less carbohydrates than I do right now. We're in different phases of what we're doing for our bodybuilding. But, I ate rice. I eat like 4 or 5 cups of rice a day because I'm trying to build muscle. That's adding fat to me. So even though I'm eating jasmine rice, which we think is a clean food, if I eat so much of that and I could still have some insulin resistance because I'm taking so much in. So I have to do all kinds of other things, keep my exercise levels up, burning the fat off, all those things that I have to do. But like you said, it depends on what you consider clean. We consider clean like fresh vegetables, green vegetables. So looking at a sweet potato, which is more fiber, high complex carb, jasmine rice, basmati rice, quinoa.
And a lot of people think eating a lot of oatmeal is eating clean, and it's actually not.
No.
Yeah. Oatmeal spikes blood sugars through the roof for hours.
Yes. And it bloats you. There's all kinds of stuff going on with that. But, we have to really know what you mean by clean. That means to me, that's, as we said, that's the outside of the store. However, that being said, there's so many pesticides and things on these lettuce, all these things that you get, even if it is naturally grown or, organic, there's still things that can be exposed to in the environment. So it's just,
eating clean could be eating a ton of fruits.
Right. And that's just,
a ton of fruits is going to spike your insulin.
It's going to spike your insulin.
Yeah, it's going to spike your insulin. So, and if you're in a weight loss mode, spiking insulin is not a good idea, period. Right. You want to keep insulin as low as possible.
Listen, I don't understand why I'm eating a bunch of fruit. What are you eating? Well, I mean, apples and
oranges,
bright
pears,
bananas, orange, all these things.
Yeah.
And like we said, berries is the best way to go. Strawberries, blueberries.
Absolutely. Yes.
It's just, like I said, it's just defining what clean is and basically portions of what you eat as well. If you overeat anything, it's not healthy. Yeah. So you have to have a balanced diet. And when we look at things, Darren, we look at macros on patients, and then we kind of put clean eating with macros, and that patient can either maintain their weight, gain weight, or lose weight, depending on what their goals are. But it's based on macros of protein, fat, and carbohydrates.
And everybody responds differently too. I do very well. Like my blood sugar is average, which most providers would freak out, and they do. My blood sugar will run anywhere from 54 to 60, 62 on a regular basis. But I've adapted to that. I do very well at that level. I do very well with a high protein, higher fat diet, low carb. I don't have trouble putting muscle mass on. So again, it's kind of an individualized thing in regards to, that eating clean and where you're at. So, you might be able to tolerate more carbs. You might be able to tolerate less. One good way to tell, continuous glucose monitor. If you have concerns about what your blood sugars are, what your insulin levels are, get a continuous glucose monitor. Your physician can write a script for it. Most likely your insurance will cover it. Not painful whatsoever. Unbelievably convenient. It links into your phone so you can monitor at the very moment, instantaneous, monitor what your blood sugars, hence what your insulin is doing. And so you can actually see how your body responds to different types of carbohydrates. You might respond very differently to jasmine rice versus basmati rice,
Correct.
or you might respond very differently to sweet potato and white potato. It's so individualized. So if you're really concerned about your health and you're really wanting to push that limit or push your body and really get super healthy, continuous glucose monitor is absolutely a great way to go with it. So that way you have like instant access to what your blood sugar is doing, how your body responds, and then you can really customize your diet to that.
Absolutely. Where are we here?
I'll take the next one because it's kind of the keto diet's kind of my thing.
That's your thing.
Yeah, Greg from Clendenin
thing.
says, I'm a diabetic. Is a keto-based diet something I can do? You know, there's all kinds of new research coming out. Even type 1 diabetics, people that have inherently malfunctioning pancreatic issues in maintaining insulin and controlling insulin, respond well. That's what the research is showing now, respond well to a keto diet. You need to be managed well, and you need to watch your blood sugars, watch your insulin, right? Absolutely, a diabetic, even type 1, can do well and respond well to a keto-based diet, right? There's all kinds of research coming out now. It's going to help you with your maintenance of your blood sugars, maybe less medication. It's going to help with a lot of different things in regards to that. Type 2 diabetic, absolutely, right? A lot of type 2 diabetics we've worked with, we've actually reversed their type 2 diabetes, and they're not diabetic anymore by controlling their blood sugars and their insulin via keto diet. And for those of you who don't know, when we talk about keto diet is going to be a high-fat, moderate protein, and a very low, when I say very low carbohydrate diet, usually less than 30 grams of carbohydrates, ideally 20 or less. And you're just going to be getting those from inherent carbohydrates within things like nuts, maybe a little bit of fruit that you can eat, which is very little, but there's just going to be, even cheese sometimes will have a little bit of carbohydrates in it. So it's just the very small amounts of carbs that are in foods that you're going to be eating. But again, it's a very high fat diet. And again, moderate protein and very low carbohydrate when we're talking about keto. And so a lot of these patients we've seen completely reverse their diabetic metrics, their blood work, via keto diet. So it's extremely successful, and it's a whole lot easier to do than what it was 10 years ago. You can walk into the grocery store
There's
and buy,
so much
there's
available.
keto-based everything now, low carb-based everything, from wraps to breads to you name it, right? And so it's a whole different, you can even buy keto-based snacks that are pre-made now. When I was doing it 10 years ago,
No,
you
had to do
made everything,
yourself.
like everything. And so it was a lot more difficult, but it's really easy now. Okay. And you can eat very clean with keto diet, because when you're going to be talking about fats, we're not talking about saturated animal fat. We're talking about olive oil. We're talking about almonds.
Yes,
we're talking
good
about
fats.
walnuts. Excuse me. We're talking about, MCT, coconut oil. Okay. We're talking about eggs, yolk fat, right? So we're talking about clean fats, not sausage.
And this is what the majority of people do when
it's
they think they're eating keto. And you'll see them, they're loading up like a whole handful of the bacon at the breakfast bar and the sausage, and that's just all saturated fat. That's not the concept.
Yeah, and that's not. And we have patients coming in all the time, and they'll be like, I don't understand. I've been doing this keto diet. My triglycerides haven't changed. My HDL is still up. My HDL's down. My LDL's up.
Horribly.
I still don't feel good. I've lost some weight, but I don't understand what's going on. It's because they're eating a terrible keto diet. Like, it's sausage and bacon every morning. It's steak, fatty steak versus clean cuts.
Yeah.
So it makes a massive difference in the types of food that you eat in regards to the high fat. Makes a massive difference. But again, it's something that for diabetics, the keto diet absolutely could be one of those things that could turn your life around.
We have seen
definitely
that. We've seen people actually go off of some medications because they're on the diet and taking some supplements that help with that.
Yeah. It absolutely can be very beneficial. So it's one of those things, if you do have diabetes, if it's something you want to do, talk it over with your physician. If they're not very knowledgeable about the keto diet, absolutely give us a call. We'd love to sit down, have a discussion with you.
He wrote on it. So
love to have a discussion with you about it, go over it, and then manage that for you and help you on your way to better health. Absolutely. So just let us know.
What's next?
Let's see. Lydia from Hurricane. I've read a lot about a cortisol insulin interaction. Is it bad? So this is one of those things. Cortisol in itself is not bad. Insulin in itself is not bad. They work completely opposite, right? And so for those that you don't know, cortisol is basically your fight or flight hormone, okay? So you get into a very stressful situation. Now, it could be anything. It could be tests, could be health, could be that you're not sleeping.
Correct.
So high stress leads to high cortisol. So cortisol actually shuts off insulin to an extent. Cortisol increases blood sugars because it says, hey, you're under stress. You need to adapt to that. You need energy, right? And so cortisol raises your blood sugars. It pulls blood sugar out of the liver by a hormone called glucagon. And so then that's released. And then so your blood sugars spike, right? So then again, eventually what has to happen is your body goes, oh, blood sugars are spiking.
Then I got to
throw insulin in there. And so then insulin flies in here after it's been shunted and stopped because blood sugar gets to a point that starts to become dangerous. Insulin comes flying in to save the day. And then the problem that we can get is that the insulin then can take all of the blood sugars that have been released. You can get into hypoglycemia
again.
Or the other thing is because it's still shunted so much from the cortisol that you have all this excess blood sugar left that doesn't get burned off. And then insulin says, I can't do anything. And so then the problem is insulin is basically left inactive because it really can't do anything because cortisol is inhibiting it. And so you have all these blood sugars going around, and guess what happens to those blood sugars? They end up as belly fat, right? They're going to go to liver or they're going to go to belly fat. So high diet or any kind of lifestyle that leads to high cortisol. Cortisol does a couple things with hormones, insulin being one. But one thing it does is if you're a female, particularly with a lot of belly fat, it could be a cortisol problem.
Correct.
And again, it's not something that's got to be high stress. Like, it could be you're just not sleeping well. It could be that your nutrition's not very good. It could be that you're sick. Obviously,
yes, you're stressed.
Can cause cortisol to be released. But there's a lot of things that can cause cortisol. Obviously, if you're in a fight or I'm scared, cortisol is your best friend, right?
Your best friend.
You need the cortisol then. But on a general daily basis with most of our lives, we don't really need much cortisol. And so the problem is if cortisol is present in a good bit because of stress, we're having all these blood sugars floating around. Insulin's limited. And so then blood sugars floating around can become very toxic, can break down alcohols. Then you have problems. Then you can get with diabetic ketoacidosis because those turn into acids and ketones in the body you can't do anything with. And so your body doesn't want that. And so then once it turns it into fat. And so typically cortisol fat is going to be belly fat.
Yes, it is.
And so that's the problem. And so cortisol stops insulin, right? And so that's the thing with cortisol. So cortisol can be your friend and you want it there. But again, we don't want it in very big supplies, especially with our lives for the most part now. Now, back a couple hundred years ago, when a lion was chasing you down because you were or something like that, might be a big difference. But we just don't need a whole lot of cortisol now. It's your friend in the gym, right? If you're exercising, cortisol is great. But other than that, cortisol in high amounts is not your friend whatsoever.
And normally in the morning, it's a little higher. It's the highest time of the day, most likely for that. And it's different all throughout the day. But this is kind of going off the topic of insulin for a moment. But cortisol is actually, I refer to it as the mafia boss. When it is elevated like that, it blocks every cell from recepting hormones,
testosterone, estrogen, progesterone,
thyroid hormone. I had a client this week, her cortisol is like 35. That's like almost 20. It's super high. And it's been like this for a while. So what's going on? Hypothyroid, because she's not absorbing. Her active thyroid level is elevated, but the cell can't take it in because that cortisol is blocking that. And that's happening with the hormones. So we've got to adjust the cortisol and try to get, just like we'll do with insulin, get that down, and it actually can normalize the body to a certain extent. So it's your friend, but you don't want it too high and you don't want it too low.
Yeah.
You just got to.
It's one of those things that, you need to know what your levels are. So if you've not had your cortisol looked at, if you've got some of these issues going on, or to say you're on hormone therapy and it doesn't seem to be responding, could be very well a cortisol issue that somebody hasn't addressed. So it would be a really good idea for you to get that checked out. The other thing with cortisol too is that if you get up in the morning, cortisol spikes early in the morning because it wants you to have energy. You need to get up, get vibrant, get alive, get going, right?
Exactly.
So when you wake up, cortisol naturally spikes. Okay. Now, the problem with cortisol, though, is it is susceptible to a couple things. One, caffeine, right? So if you get up in the morning, drink a lot of caffeine, you're actually blocking the receptor sites for it to go in, for cortisol to go in and get used. So then cortisol is hanging around. Well, after it starts to hang around for a while because of the spike in the blood sugars and those things that it causes, you got cortisol around in the afternoon, you're going to get tired, right? You're going to have that mid-afternoon slump, like 2, 3, 4 o'clock, where you're just kind of drowsy. Caffeine doesn't really help. It's because you're overloaded with cortisol because you're kind of getting your secondary burst that's working in, getting you prepped and ready to go to bed, relax, sleep at night, those types of things. So, one of the things is if you're looking at consistent fatigue in the afternoon, then it could be the fact that, you've got too much cortisol around then as well. And easy fix for that is when you get up in the morning, try to abstain from caffeine for first 90 minutes after awaking. That allows cortisol to get up. It allows you to, it does its job, right? It's going to spike your blood sugars a little bit, get you some energy. It's going to kick in some adrenaline because that's what it's supposed to do. Again, it's a fight or flight hormone, and it gets burned off, right? So give yourself 90 minutes, then use the caffeine, and you should get a secondary burst of energy. You'll actually feel more energy from that and probably have more energy throughout the day by waiting 90 minutes.
That's true by personal experience. If I get up, to make my coffee, I take it with me to the gym. I open a gym in the mornings and I take it. I don't drink it yet. And then actually I have found that if I don't do my cardio, if I don't do cardio fasted, personally for me, fasted cardio, then drink my coffee. After that, I get the 2 o'clock slump. But last week, every day I did that cardio. I did not have that 2 p.m. slump. So I know it's me burning off what cortisol I have and then taking the caffeine after that. And I'm not even getting sleepy in the afternoon. It's absolutely a difference.
Yeah. With
It's
our
very
patients that we initiate that
Mhm.
consistently across the board, very few say that they don't notice a difference.
Mhm.
By far, a majority of the patients go, yeah, I can tell I've got more energy in the afternoon by delaying my caffeine later and allowing cortisol to do its job. So there is a major cortisol insulin reaction that can be negative. Again, cortisol can be a very good thing as well too. But the key to it is knowing what your cortisol levels are.
And keeping it in a good place.
Find a physician, ask your physician about doing blood work, whether it should be managed. If it's too low, too high, you need absolutely to get that adjusted. We could have a whole nother session on cortisol, because that's a very good indicator on how healthy your adrenals are, because that's the cortisol comes from the adrenals, right? And so, if your cortisol is dysfunctional, right? If it's too high, too low, that's a key indicator your adrenal glands aren't working. Like, it could be that they're fatigued, could be that they're diseased, could be a lot of other things going on. So cortisol is one of the things you definitely want to know what the levels are. If you don't feel good, you need to know what your levels of cortisol are. Okay. Let's see.
We answered everything.
I think the only one left was Sherry from Hometown. I don't think we answered this one. Does insulin affect body fat? Did we cover that one?
We kind of did.
We kind of did.
Kind of did.
But real easy. Higher levels of insulin absolutely can promote body fat because it gets left over if all the insulin doesn't combine sugars. Or again, the other thing with insulin is, how does it affect body fat? If it's high in a high number of presents, or if it's present in a high amount, then it's going to cut off that fat oxidation. So insulin itself doesn't necessarily affect body fat directly, but what its affects have can absolutely affect body fat, because it can shut that fat oxidation, fat burning down. Again, also, because if it doesn't go out and grab all the blood sugars that are out there for whatever reason, if there's something wrong with that matrix and how the pancreas is releasing your insulin and grabbing those nutrients within the blood, primarily sugars. If it's leaving excess sugar in your blood and it's not pulling all of those out because some kind of dysfunction or something inhibiting with that, then again, you're going to get that belly fat, right? And so insulin does affect fat, but not directly. It doesn't actually promote fat one way or the other. It's just the effects of insulin or lack of the effects of insulin.
Effects of it.
Yeah. So those are just some of the things that, we've had questions about. As always, if there's other questions that you would have or specific things you'd like to know, absolutely email us at totalhealthpros.com. We're on Facebook as, Facebook is Ascent Elite Health. On Instagram as Total Health Pros. Phone number 304-382-2080. You can get a hold of us that way very easily. Send a text, give us a call. We're here to help you, right? We're here to give you some knowledge, help out. Go to our website. We've definitely got a lot of updated blogs on that as well.
And I want to mention there too that there's all kinds of venues to watch these videos.
Yeah.
All kinds of sources. You don't have to go to YouTube. There's different avenues. I think probably 10 different avenues that you can watch.
We're on Facebook. A lot of our podcasts are on Facebook. They're on Instagram. Obviously, you can go to our YouTube site, Total Health Pros, Ascent Elite Health, and watch them on there. We're curating those and accumulating those on that as well too. So there's a lot of avenues, a lot of ways to get in touch with us. And if you've got issues, please don't suffer in silence.
No, do not. Give us a call.
Yep. Really appreciate you guys. Thank you so much. Have a great day.
Bye.